Welcome, everybody. We are very excited to welcome our guest today. It's, of course, Dr. Robert Malone, whom we've had in the past. And inevitably, when three physicians get together and discuss clinical matters, we get silenced. But things have gotten a little bit better in recent months and years. However, we are going to take a minute to look back at some of the phenomenology that we've all been subjected to. Dr. Malone, of course, is a physician, scientist, writer. He went to Northwestern Medical School, Harvard Medical School Fellowship, and then trained in his molecular biology at University of California, Davis, and at the Salk Institute and Virology Laboratories. He is thought of as one of the inventors of mRNA technology and has had thoughts about it. God forbid, somebody who is a scientist and physician have thoughts. But today we're going to focus in a little bit on the Psyops. Dr. Kelly Victory, of course, is here with us, and she was a psychologist before she became a physician. And she's got a lot of interesting questions, so we're going to bring her in here real early. Let's get right on to it.
Our laws, as it pertains to substances, are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want to help stop it, I can help. I got a lot to say. I got a lot more to say.
Yes, as we said, there's a lot to look back on now. Mass formation psychosis, which a concept I first heard from Dr. Robert Malone. And Dr. Malone has been very helpful in helping us understand what we just went through. We now have a couple things happening that are breaking news. One is we have Dr. Fauci in a New York Times article looking back and saying, what are you talking about? I didn't tell anybody to really do anything. I was just giving suggestions. Wow. And we have some data out of the UK from the ONS that they found that the death by vaccination status, something that Steve Kirsch has been asking for in this country, 9 out of 10 COVID deaths over the last 2 years in vaccinated patients, more likely to die with 3 or more vaccines. Now, we can argue about the fact that 90% of the people in the UK are vaccinated. Maybe it's just reflective of that. And perhaps the multi-vaccinated were sicker or older, but it's worthy of a conversation. At least they gave us the data a year later. So let's get to my guest. Of course, Dr. Robert Malone is a physician, scientist, and has been someone at the forefront of trying to help us understand some of the controversies in this recent pandemic. Welcome, Dr. Robert Malone.
Hi, sorry I have to broadcast here from the car, but I'll do my best.
We will take you in whatever condition you present yourself by any means necessary. So you've been talking a little bit about some terms that I'm not sure I fully understand. You were the first person I've heard the words mass formation psychosis. I've heard it multiple times from other psychiatrists and mental health professionals since, but now you're talking about psywars and psyops. Tell me about that.
Well, first off, regarding mass formation, which is technically the correct term, I started using mass formation psychosis because it was the term used in 2 of Matthias Desmet's first podcasts. And since then, Matthias has become a friend of mine. By the way, he just recently wrote a Substack essay in which he discussed the origins of the term mass formation and mass formation psychosis and clarified the attacks that I've received that I had invented the term in some way and that this absolutely is not the case. In terms of psywars or 5th generation warfare, this is another term that is now being attacked. I was the other day asserted to be a anti-government disinformation specialist, I guess, by the what was it? The Anti-Defamation League, so that's their position. But in fact, 5th generation warfare and psywar are terms that have been used for decades, and there's good literature about it. So you want to get into what is 5G warfare? Did I lose you?
Oh, wait. It appears, sorry, producer here, it appears there was an issue. Wait,
I
here's
think that may be us.
There he is.
Are
There's
we
Drew.
are back?
Drew,
Okay,
you're back.
sorry. We
You're
had a
back.
little fart in our connection here. But I'm really mostly interested in using these concepts that I don't really understand to understand what we went through and why it was so extraordinary and why they were so effective and what's wrong with us that we fell for it, if anything, and how it infected, how this
Okay.
phenomenon
Um,
took the whole world
yeah.
in.
So, fifth generation warfare or Psywar is a group of technologies and an approach to conflict that has emerged largely in response to the insurgencies of the Viet Cong, Al Qaeda, the Taliban. And it's a suite of technologies and capabilities that you could think of as an extension of marketing technology, deeply rooted in psychology, that is designed to be able to influence the thinking mind and the emotions of individuals. It is really the core basis for what we call the algorithmic control of information that's deployed by most social media, but it's so much more than that. It's a suite of technologies, tactics, and strategies that are used by militaries throughout the world in order to infiltrate really the thought space of the opponent in a subtle, low energy way, typically in a leaderless fashion. So if it's clear to the populace that's being impacted that they are being subjected to this Psyops type technology, then the perpetrators, the folks that are pushing that information, have actually failed. So it involves the whole range of approaches that we've come to be familiar with in social media, the use of trolls and bots. It involves things like crowd stalking, which is now being used by the and cyber stalking that are being used by the CDC against physicians. So that's one of the things that's happened. You asked what's happened to all of us and why have we been uh, influenced by this technology. Physicians and medical scientists have been specifically targeted. This came out in a recent article with whistleblowers from Epoch Times that disclosed that the Foundation for CDC had set up a contractor which had then assembled groups of folks on social media and would then broadcast out targets and alerts to that group when physicians who were speaking in ways that were not approved or were considered to be misinformation would then be attacked. And on social media, they would work in concert to try to deplatform them, work in concert to try to get them fired from their jobs, and work in concert to try to get them get their medical boards to take their licenses. So this is one aspect, but it's, like I said, a whole suite of psychological manipulation technologies that are commonly deployed through social media and, of course, through corporate media. Have I answered your question, at least as a start?
Yes, for sure. And I watch my wife's producer wife behind the screen, her hair stand on end when you talk about this stuff, because she's been convinced that China was actively involved in these kinds of activities for quite some
They
time.
are.
And
China absolutely is. But in the case of the Five Eyes nations of the U.S., Great Britain, Canada, New Zealand, and Australia, it's also been military psyops units that have been deploying this tech against their own citizens. And that's been very well documented in a variety of FOIAs with subsequent uh, um, newspaper articles in all of the Five Eyes nations. In the UK,
let me ask:
it's called the
yeah, is
77th
that
Brigade.
is that what we're seeing? Two quick questions and then I'm going to bring Dr. Victory in here because she has a million questions on this front, and I want to get her in as fast as possible. A, is this what we were seeing evidence of on the Twitter files that dropped with Matt Taibbi and Schallenberger and those guys? A, shit, my other question. Go ahead and answer that one first.
Yeah. The Twitter files certainly provide more supporting documentation for the deployment of intelligence community assets and also Department of Homeland Security assets seeking to influence both directly and algorithmically the functionality in Twitter, and by extension, I think we can infer YouTube, Facebook, etc.
Yeah, oh, for sure. No doubt. And so I remember my question now, which was, we have these extraordinary comments by Justin Trudeau and
Yes.
Anthony Fauci and Michelle Walensky, who are all now like, well, I don't know what you're talking about. This is what do you mean? I never saw. I know it. I wonder. I'm going to ask you to speculate. And this I know is pure speculation. I wonder if they didn't know these things were underway and have just recently discovered they were and are like not feeling good about it.
Dr. Drew, one of the ways that I've managed to keep myself relatively clean is by not speculating. And if I don't see documentation
Okay. All right.
or receipts,
All right.
if I don't see receipts about what people are doing, then I try not to pretend that I can get in their head.
Fair enough.
However,
Fair enough.
It is quite clear that, for instance, you mentioned Walensky, and of course, we have others that were in the original commission with Dr. Fauci that have used language such as, well, we didn't know that the vaccines would work. We hoped that they would work.
Right.
So
right.
It's hard for me to accommodate these protestations and assertions of ignorance. Remember that Dr. Fauci claimed loss of memory under sworn oath to the Attorney's General lawsuit, I think 160 times. These are folks that you don't get to that kind of a position in DC bureaucracy with, let's say, your integrity intact. That's just the way the business works. It's one of the things that happened was that Trump declared a whole of military response. Just to put a pin on it in terms of who launched this. And with that came in the military Psyops operations, and in the UK, MI5 and MI6. So
makes sense.
We've known that it was happening. It is very hard for me to believe that Mr. Fauci was ignorant of this. Rochelle Walensky, I don't know what to think about her. She seems I just don't know how to understand Rochelle Walensky and her gaps in understanding. But Mr. Fauci has, of course, testified that there was no gain of function research funded by his operation. And we have the former director of the CDC directly contradicting him, that it was funded by NIH, DOD, State Department, and USAID. And then once again, Judicial Watch has found the receipts through their FOIA actions, and we have an extensive body of over 500 pages of documents from the contract award, proposal, and annual reports from EcoHealth Alliance that clearly document the gain of function research for both SARS and MERS, by the way.
Yeah. So we're going to take a little break, Dr. Malone. I'll give you a little breather here while I bring Dr. Kelly in about 3 minutes. But I just want to say that I'm having the strangest emotional reaction to this material because on one hand, I am mortified, meets disgusted with what we've been through and what we're learning was happening and how I'm okay with these people saying we didn't know. Then why the certitude? Why the destruction of anybody who had alternative opinions? Why get out there and say categorically this is so? And do you not understand how media works? Do you not understand the impact of your words? It reminds me of the guys signing the Hunter Biden thing about. Yeah,
we documented.
We didn't know. We were just saying it looked like Russian misinformation. We're just saying it looks like it. This is bullshit.
Credible.
This is bullshit.
Yeah,
this is incredible. We have to hold these people accountable. RFK said something incredible yesterday. He said, somebody asked him, what would you do as president if you were to bring this country together? You know what he said? Get them to stop lying to us. Stop lying. Stop lying, and we'll kind of come together on our own. It would make a huge difference. And by the way, explain yourself and apologize. I'll accept it, but stop lying. All right, we're going to take a little break. Be right back.
You're a little wild.
Over the last few months, no doubt you've heard a lot about spike protein, certainly on this program. The reality is, once lockdowns are well behind us, we will likely still be dealing with the effects of COVID and potentially the COVID-19 vaccines. Therefore, the spike protein may prove to be an important part of our story. With that in mind, I want to introduce you to the wellness company's spike support formula. Whether you've been vaccinated or not, spike protein may be something you have become concerned about. Good news is that there's some interesting research on how to potentially deal with it. Studies have suggested that nattokinase and dandelion root are showing some potential in protecting you and your family. Our friend Dr. Peter McCullough and the team at the Wellness Company have the only product on the market that contains both nattokinase and dandelion root. In addition to the nattokinase and the dandelion root, the Wellness Company's spike support formula also includes natural antioxidant ingredients such as black sativa extract, green tea, and Irish sea moss, all thought to help boost immune health. Go to twc.health/Drew to order today. Use code Drew at checkout for 10% off today. Springtime is here, and personally, I can get red and irritated skin during these months, especially when I travel. But now I have an extra layer of protection thanks to Genucel Skincare. Genucel's Ultra Retinol, formulated with the most powerful retinol alternative, bakuchiol, and proprietary MDL technology, soothes irritation and visibly targets red, blotchy skin. And the under eye cream, of course, helps hide the bags and puffiness that you can get from travel and just lack of sleep generally. In fact, you might have witnessed the astonishing effects of Genucel Redness Repair Intensive during a recent unplanned moment of our show, repairing my skin within minutes right before your eyes. That is how fast these products work.
I know I'm a snob about the products I use on my face. Everybody knows it. Every time I go to the dermatologist's office, they're just rows and rows of different creams. Retinols, vitamin C cream, under eye cream, night creams.
Scrubs.
And then when I get to the counter, they're overpriced. All kinds of products that you can all find at Genucel.com. I've fallen in love with this product at a fraction of the price.
Visit Genucel.com/Drew today and check out the personalized packages from Susan and myself, bundled with our favorite Genucel serums. And remember to use the promo code Drew for an extra 10% off. All orders are upgraded to free shipping. Plus, if you order now, every subscribe and save package gets a free spring spa package with 3 of Genucel's best-selling spa products, ready to try in the comfort of your own home. One more time, that is Genucel.com/Drew, Genucel.com/Drew. Inflation has consequences. As the Fed raises interest rates to combat out-of-control government spending, long-term bonds have diminished in value, crippling banks. Depositors are holding their breath and investors are bailing on bank stocks. Diversification has never been more important. The recent surge in gold prices is directly tied to the extreme market volatility right now. This is why gold has historically been a great hedge against the stock market and against inflation. Now would be a great time to diversify into gold with Birch Gold Group. Birch Gold makes it easy to convert an IRA or 401k into an IRA in precious metals. Here's what you do. Visit birchgold.com/Drew to get a free info kit on gold. They'll help you convert your existing IRA or 401k that is tied to a volatile market into an IRA in physical precious metals. I do not give financial advice, and previous performance is no guarantee of future performance. With an A+ rating with the Better Business Bureau, thousands of happy customers, and countless 5-star reviews, Birch Gold is who you can trust to protect your future. Visit birchgold.com/Drew today. That is BIRCHGOLD, birchgold.com/Drew. Some platforms have banned the discussion of controversial topics. If this episode ends here, the rest of the show is available at drdrew.tv.
There's nothing in medicine that doesn't boil down to a risk-benefit calculation. It is the mandate of public health to consider the impact of any particular mitigation scheme on the entire population. This is uncharted territory, Drew.
Dr. Kelly Victory joins us. Before, Kelly, you jump in here, we do have a couple of quick points. We're having technical problems on Rumble, which is very rare, but I don't know if it's...
Sad because 8,000 people were waiting.
Dr. Malone is radioactive, and he caused the whole thing to fall offline.
The website's down, yeah.
But the other thing, as long as I just want to quickly, before I turn Dr. Kelly Victory loose on you, some stuff came through on the chats and stuff about questioning your background, your being called an inventor of mRNA technology. Why is that an issue? I don't have a horse in this race. I just want to give you a chance to clarify that.
I don't know what the comments are. I get criticism from the left and the right, and I have a group of about 8 different cyber stalkers that are constantly making stuff up about me. In terms of my role in the invention of the technology, inventorship is defined by patents, issued patents. It's the U.S. Patent and Trademark Office that defines what is an inventor. And I happen to hold 9 issued patents that all cover this technology. And they were filed primarily in 1989 to 1991. And I also happen to hold the original invention disclosure from my time at the Salk Institute for the use of RNA as a drug and for these types of applications. Now, there's absolutely no question that there have been contributions from others. There's many that have worked diligently for years to bring this technology to the point of application in humans for what it's worth. There were key findings from the company Arcturus, in particular, in the University of British Columbia group, hence the name of the latest virus variant, by the way. But in terms of the invention of the core technology, reduction to practice, demonstration that you can use it to elicit an immune response in a mammal, the manufacturing of large-scale RNA and purification, the genetic sequences and elements necessary to make it work, the use of positively charged fats, and the demonstration of it working in animals, both for gene transfer and for eliciting an immune response. All of that comes off of my bench. So you can call it what you will. I don't wish to diminish anybody else's contribution, but I'm also a little tired of other people asserting that they are responsible for my contribution.
There we go. Kelly, have at it.
Hey, Dr. Malone, great to see you. Thanks so much for joining us. And I can attest that your pedigree and experience are beyond reproach. So I would just put it to bed. I'm tired of having the conversation with others about that as well. Before I do, and by the way, that was before the break, you saw Drew was exhibiting the appropriate way to be triggered by something that's actually appropriate to trigger you. So thank you for that for living by example, Drew. Thanks for that. Before we go back to this 5G and the Psyop thing, indulge me, if you will, for a minute. As Drew said, I was a psychologist before I became a physician, yes. And I have not only a lifelong interest in, but I think some level of expertise in what I would have called in the olden days mob mentality. The interest, the idea that the individual, I used to say that the single most dangerous entity that exists in the world is the mob. Because when you get 10 or 100 or 1,000 or 10,000 individuals together, they no longer function as 10 or 100 or 1,000 individuals. They become a new entity with a singular focus known as the mob. And they are able to divest themselves of the moral and ethical and many times logical vestments that would otherwise control them as an individual. They take on the anonymity of the mob, and they are capable of doing things that would heretofore been absolutely, just never even considered. The individual by themselves would not do such things or even contemplate them. Back in the olden days, meaning when you and I and Drew were training, in order to have a mob, they had to be geographically in the same location. Now, by the wonders of social media, the mob can actually be in disparate locations. And they take on, however, that same potentially vicious, absolutely vitriolic, vicious personality of a singular entity. And I want to talk a little bit about what your thoughts are. How it does the mob in your mind? Is a mob different from the mass formation, or are we really talking about the same concept that I would have called a mob in the past, just with a new terminology called mass formation?
No, mass formation is related, as you point out, but it's has significant differences. And Kelly, I recommend, if you wish, that you guys get Matthias Desmet on and allow him to talk about his theory rather than using me as a surrogate. But I'll do my best, as I
Sure.
did on Rogan, to try to do him proud. And he's recently written another Substack about the origin of the terminology and some of the fundamentals, in which he absolves me of the accusation of having invented the term. So that's that. So what Matthias describes, which is in a significant way a 21st century update of Hannah Arendt's work in The Origins of Totalitarianism, in which she focused on the behaviors that she observed in Nazi Germany and subsequently, which became a major focus of hers as a Jewish woman who had survived the Holocaust, and so had deep personal insight into these things. And so what the core thesis is that there's a series of preconditions, and there's some debate about those preconditions, but these preconditions include things like existence of free-floating anxiety, disconnectedness of the individual from a broader social structure, the sense of futility. Matthias speaks about bullshit jobs, people that are facing a world in which they aren't really performing any true function. They feel isolated, frustrated. The use of the technology, whether it's the internet or cell phones, certainly seems to have accelerated this phenomena. And there's lots and lots of data concerning the disaffection of people in these current times. And then that often gets transformed first into free-floating anxiety. I'm sure that's something you can expound on. And then typically as that free-floating anxiety coalesces, you have a group of individuals that are suffering this, that are disconnected from society, angry, and seeking some target to relieve their anxiety, to provide some focus and explanation for what they've experienced. And they will often coalesce around something, a significant threat that presents itself. And it can be a true threat or it can be a manufactured threat. And it can be organically obtained or it can be synthetic. It can be something that is actively promoted by, Lenin or whomever, Goebbels, just to give a couple of examples. So that's the core thesis. And then once they have that target of their anxiety identified, then they form this is where we get into your mob or group or whatever you want to call it, psychology. Once a group of people have identified a subject that they can coalesce around, they form social bonds, which relieves their sense of this free-floating anxiety and disconnectedness. But it's a very odd social bond and grouping. It's not interpersonal. All of them tie back to typically a leader, a central leader, who is giving them this some sense of mission or purpose or focus of their anxiety that they can address. And this appears to have been what coalesced around COVID as a threat. And then we had leaders who were promoting the, I call it fear porn. I hope you forgive me. It is in Psychology Today as a real term. I've become rather defensive about people who attack me about things that aren't in the DSM. But as you know, the DSM covers individuals, not group behavior. So people seem to have coalesced around COVID, and the people that were promoting the COVID fear porn, this solution to their anxiety, this focus point, then became the identified leaders. Tony Fauci would be a great example of that. Deborah Birx would be another one. The Tedros at the WHO would be another one. In many ways, Mr. Gates became such a focus of worldwide attention as a leader that can potentially guide us all out of our this risk and threat that we're facing. Typically you have an authoritarian step into an environment like this, exploit it, and then use the fear and anxiety around that event to focus the crowd towards some objective that they want to pursue, whether it's a political objective or an economic objective or social restructuring or whatever. So that's my attempt to give Matthias Desmet's mass formation and really Hannah Arendt's work credit. I hope I did them proud. Dr. Victory, what's your thoughts on this?
No, I think that was brilliant, and we would love to have Matthias Desmet on. So we'll take you up on an introduction there. But I think you did really a masterful job summarizing it. A couple of thoughts. I want to move over to talking about our good friend Anthony Fauci in a minute, but I want to give some thoughts on what you just said. A couple of things. There's no question, I think, that certainly here in the United States, we were ripe for this sort of thing because of the amount of free-floating anxiety, the fact that people are anxious and disconnected, and the more social media we have, the less connected people really are. It's the anti-social media, as I say. It's not. It's purely gives people the illusion of connectedness when it's really quite the opposite. And if you look at the three most commonly prescribed drugs during the most recent Trump heyday of the economy, everything's booming, and the three most commonly prescribed drugs are for high cholesterol, depression, antidepressants, and sleep aids. So for a country that was doing remarkably well, we're the most insomniac, depressed group of people you've ever met, fraught with anxiety. The other thing is, I would say, you have been generous enough to give us some little glimpses into your personal life there on your gorgeous piece of earth on your farm there in Virginia. And I know that, like me, you have horses. And if you watch a group of horses in a field or in a herd in the wild, when one horse starts to run, the others, with rare exception, will begin to run as well. They start
Absolutely.
to
They'll all
run,
bolt.
despite the fact that they have no idea what they are running from. And it is the consummate, and that is how I feel much of the population has been. They have formed into a mob. They formed into the mass. They formed into, and they are running and fearful, and they don't even know what the hell they're fearful of. They've become thoughtless.
That is the key thing that you just put your finger on is fear. A lot of this is driven by fear and anxiety, and that just brings out the absolute worst in human behavior as far as I'm concerned. But go ahead. I'm sorry I interrupted you.
No, that's exactly right. And I think that none of this could have happened. Fear is an incredibly powerful intoxicant. It is the number one way to control and manipulate people. So keeping people in fear is really the key, the cornerstone to this entire thing. And as you noticed, each time when we would start to get our arms around, start to get ahead, the numbers would start to fall, or people wouldn't be getting sick. Then, roll in, enter monkeypox, enter the next.
Right.
Enter RSV, enter the next thing.
Well, Kelly, we have as one, like I said, I like to talk about the documents and receipts, things we can prove. And the lockdown files from the UK clearly document the deployment of fear by the government in order to manipulate the society and to gain a willingness to comply with government edicts.
Yeah, they actually documented it. There are emails. There are emails where they said that.
I've seen that in FOIA here and there. Why isn't that being addressed as something that should be or could be outside of the law, maybe, if not certainly outside of the responsible functions of government?
Well, Drew, the answer is we can talk about this stuff on social media, but corporate media has, I'm sorry, this is a strong metaphor. They have blood in their hands. They have been directly implicated in deploying fear at the behest of the government, and also accepting money from Pfizer for a lot of these things. You remember the running bars that were on virtually all major corporate news broadcasts about the death counts, etc. I mean, the fear was just pumped and pumped and pumped. And this is why I think, you were mentioning appropriately, I appreciate your a sense of outrage as to what has been done to us. And I think those are the right words. This was active. So Mr. Fauci assertions of um, ignorance and lack of comprehension is just flat out duplicitous. It's has no integrity. Right. He was actively involved in a lot of this psychological manipulation because he was the front man. And then, you can't discount the documents we have about the Great Barrington Declaration and about his directly targeting three of the top epidemiologists in the world. And then we have if we step even further back, the smoking gun, as far as I'm concerned, is the use of burner phones by him, Farrar, and the director of NIH, Francis Collins, when they're having their discussions about basically how to cover up the origin of the virus and their involvement in that. I mean, at this point, the reason why we're not hearing about it, getting back to your question, obviously, is because corporate media is very much involved in what has been deployed and has the tragedy right now. One of them, I mean, it's layers of tragedy. There are virtually no politicians in DC right now that want this topic discussed. The only presidential candidate that has any motivation to talk about this topic is Mr. Kennedy, which, by the way, I was there for his presentation, his kickoff in Boston. It was a stunning hour and 45-minute speech, and in which he carefully focused on the lockdowns and the lockdown damage and avoided talking about the jabs and the failure to provide early treatment. It was quite a nuanced, passionate speech. He has been very clear all the way through this. I was fortunate to be with him on the Lincoln Memorial 2 Januaries ago for the Stop the Mandates protest in DC that was so well attended, in which he just launched into a diatribe. And this is before he had his surgery, so his voice was quite weak. But he predicted that the government would not stop all of this lockdown behavior, all of these breaches of the Bill of Rights, until they were forced to do so. And in fact, that's what happened when Congress finally voted. So we have a problem, and you two know it, and you two are warriors in the front lines of it by going to social media in the way that you'd have. We have a major problem with the capture of corporate media by large financial interests that are all horizontally integrated, as well as by the government.
I had a front row seat. I had a front row seat on that one. Yeah, because when I got myself in trouble, by screaming when I saw the panic porn, which is what I called it 3 years ago, being whipped up by the press, and the press using words like grim and staggering, and I thought, there've been 300 deaths. That's not a staggering number. When we get to 10,000, what word are you going to use? And I could see what they were doing. It seemed to follow on the heels of the Trump stuff for me. They'd gotten so into this emotionality and using emotion as a way of capturing eyes that this was something they just went wild with.
Well, Dr. Drew, you need to recall Event 201. The war game that was held at the CIA shop at Johns Hopkins that was sponsored by the World Economic Forum and the Bill and Melinda Gates Foundation. And it brought in the press of many members, including from CNN, as well as many members of the intelligence community, to do this planning. And it's no surprise if you bring together folks that have an authoritarian bent, you end up with plans that are quite authoritarian. And they basically just moved in lockstep to deploy the plans that they had mapped out in this war game in Event 201 in the fall of 2019 without ever revising. I like to point out that they had three key assumptions. One was that it was a highly lethal virus. That is not the case. We now know that was Chinese propaganda with the people dropping dead in the streets and the rapid build of the hospital. Number two, that existing drugs could not treat this pathogen and could not mitigate death and disease. That was clearly false, and yet it was continued to be pushed as a storyline. And the third one was that we would have a vaccine product that was safe and effective. And I'm sorry, I noticed the CDC banner that you ran at the start in your disclaimer. But in terms of these products' effectiveness as a vaccine, they do not prevent infection. They do not prevent replication. They do not prevent spread. They do not prevent death or disease. We are arm wrestling about whether or not they might mitigate death and disease. But as you just pointed out, the data keeps coming in from all over the world that the majority of deaths are in those that are highly vaccinated. And by the way, there is a dose-response relationship. I think the three of us understand what those words mean. Ergo, the more doses, the more likely you are to get basically hospitalized or die.
Right.
Yeah.
Right. And
push back a little bit because
and
Kelly and I talked about it beforehand, and it could be they're the sicker people, they're getting them higher dosing, and there could be the older people. So there's lots of things to be sorted out yet, but we need to dispassionately sort this stuff out and take a look at it. And by the way, I just realized that when people talk about early treatment and available medication, there are the headline drugs, but let's not forget Decadron worked very, very well for COVID. It kept a lot of people out of the hospital. There were anti-inflammatories. There were things we could do that no one were doing because people were unwilling to look at early treatment with anything.
The thing that I worked on for DOD was famotidine plus celecoxib.
Right.
I used to joke in my talks when I would talk about early treatment that I knew that there was a horse drug that was available that had been proven to be safe and effective in humans for treating COVID. And of course, everybody would assume I'm about to talk about ivermectin. And I would say, no, the answer is aspirin.
Yeah,
there are clear studies on aspirin effectiveness.
I was going to say aspirin.
Well, and I think that the data are unassailable, frankly, at this point, that we know that these vaccines are causing untold adverse events. No matter how you parse the data, you can try to explain it away by they're older or sick or whatever else. I think it's really pretty darn clear if you look worldwide.
Well, then we have the insurance actuary all-cause mortality, excess all-cause mortality.
Right.
And then we also have my friend Theo Shooters from the Netherlands that has taken two different databases there because they vaccinate in waves, particularly for their elderly. And so he's taken excess all-cause mortality in elderly and is from one source and overlaid that data with the vaccine deployment waves, and you see a clear repeated correlation with an offset of a few days to about a week between the spike in vaccine deployment and the spike in excess all-cause mortality in the elderly. The data are clear, and I have a colleague that wants to stay below the radar because he's so afraid of all of the stalkers on the internet. But he is a serious, hardcore government data scientist. He literally does work on quantum computers on a routine basis. And he has applied some AI tools to the VAERS database and clearly pulled out some very significant signals relating to this. And he's given me permission to publish the paper without his name on it. So stay tuned. I mean, we're having the data is rolling in from all over the world about this, as you know, Kelly. And Mr. Fauci's protestations are not going to, I've been skeptical that Mr. Fauci would ever be held accountable, as is Ron Johnson, because he's so adroit.
Yeah. Well, that's what I do want to get into talking a little bit about him because he is Teflon. But before, as a dovetail to that, we just showed the cover of your book, Lies My Government Told Me.
Thank you.
And it's important, I think, for people to understand there's a reason you didn't title the book Mistakes My Government Made, because there's a difference. Okay, there's this difference.
Yeah.
There's a difference between making mistakes and lying. They lied. Okay. I and you
Yeah.
and others did not. I didn't say what I said from the beginning about masks, about lockdowns, about the BS of social distancing, about the dangers of the vaccines. I didn't say what I said because I'm a good guesser. I didn't say what I said because I
Right.
had a crystal ball. Okay. I based it on what we have known for decades about the inefficacy of masks for respiratory viruses, that social distancing was a made up construct. I trained in public health, and so did Fauci, and so did others of them. They know damn
That's where
well
you're
that
wrong.
that's made up.
Kelly, that's where you're wrong. Tony is actually not trained in public health. He does not have an
Okay, fair enough.
MPH. Yeah, he's basically a physician and a molecular virologist and immunologist, largely immunologist. And this is one of the sins, as far as I'm concerned, of his attacks on Bhattacharya et al.,
Yeah.
the
Yeah.
authors of the Great Barrington, is he defamed them. I mean, what else do you call it?
Yes, he did. No.
And they are far, far more qualified than he is.
And so the reality is, and my point really is that these people lied. They didn't make mistakes. Yes. And so your book is appropriately named "Lies My Government Told Me." So now we have Anthony Fauci. Fast forward to this past week. The interview he gave to the New York Times and then subsequently on CNN, where he is acknowledging, that yes, mistakes were made, things were done wrong, and he's not quite sure what they were, but he manages to make that admission while at the same time completely abolishing himself of any sort of complicity in this or any amount of responsibility for all the things that happened. In fact, he came out and said,
given your prior your training, are you willing to venture a diagnosis?
Well, like you, as I said, I have not ever diagnosed the little troll, but I can tell you that truly he is an unbelievable narcissist. He is absolutely. I mean, narcissism, if you look up the word narcissism in the dictionary, it says, see also Anthony Fauci. Yes. Exactly. It says, see also Anthony Fauci. He is absolutely remarkable in his ability to say, no, it wasn't me. He is looking in the camera saying, I never closed a school. I never closed a factory. I simply gave my guidance. And if people made those decisions, that's on them. It's absolutely reprehensible.
So I think we can agree that in the differential diagnosis are words like sociopathy and psychopathy.
Yeah. Mm-hmm. Yes. No question. There's no question. You cannot lie with that level
because the lack
of
the complete lack of remorse.
Yes. Yes. You can't.
I'm gonna give him a benefit of the doubt. Because ignorance is a defense here, and I think these people because when you think about it, he didn't. I was on a local news broadcast here in Los Angeles when they decided to lock the schools down, and I asked the guy. I said, Who told you to do this? Why are you doing this? Did the CDC tell you? Did you get an infectious disease consultant? No, it's just the right thing to do. And it came through the state government. It was Newsom that was going overboard. Whatever the federal government was saying, he was going to do the opposite. And that wasn't Fauci, but he was there blowing wind into the sails. And the fact that he didn't understand the impact of his words is what get me upset. It's like, if you didn't understand the impact of it, I know you believe that. I know I'm giving him the benefit of the doubt for this conversation.
No.
And let's say he did, but he needs to take accountability for that.
No, you said ignorance is a defense, and that's the explanation for Rochelle Walensky. Okay, that's her out. I'll give her ignorance. Dolt comes to mind. But Anthony Fauci knew exactly the power of his words. He knew, and he's been doing this for too many decades, Drew. He's been at the helm. This is a guy who has a long history.
If I can interject, and it's in the book.
Yeah.
we did a deep dive. One of the things about being an experienced government contractor is you know how to find the information. So I worked back through the NIH phone directory and was able to account for the number of people that are in the press office for Tony Fauci. He has 50 to 60 FTE, full-time employees, or managing press. He only had about 20 managing the Senate and the House. Tony Fauci is very seasoned, very expert at management and manipulation of the press. Just read Bobby Kennedy's book, The Real Anthony Fauci, in which he documents Tony getting journalists fired. I mean, this guy is not benign. I would use stronger words, but we're being recorded. He is a very skilled bureaucratic politician scientist of the type that has really destroyed the integrity of the scientific enterprise in the United States, in my opinion. And he is the poster child for what's gone wrong with big science. And frankly, he's driven a lot of it. My history is watching him since I was a wee little thing in my, early 30s, in, the beginning of the 1980s and the start of the AIDS outbreak, and watching him and Bob Gallo duke it out. And Bob Gallo is a wickedly competitive scientist, and Tony Fauci gutted him like a fish.
Right. Well,
did he have anything to do with the wait, really quick, Kelly, one thing, because I always, I interviewed Bob Guccione Jr. back in those days. Spin Magazine put out this horrible, ridiculous expose about the Gallo Institute causing HIV and causing AIDS and all this stuff. Do you think that Fauci was behind that in some way? Is that what you have any evidence of him doing that kind of stuff?
I have no understanding of the machinations that Tony did or did not do with Bob. Bob deserves, if you saw the movie and the band played on, you have one version of Bob Gallo. That is also not a benign individual. And they basically went toe to toe over who was going to control the AIDS dollars. Bob was at National Cancer Institute and Tony won. So and Bob ended up with his own research institute in Baltimore City. That's how that played out. And
crazy.
all these things have deep roots. The former director of CDC that testified has been Bob Gallo's acolyte for years and years and years, one of his lieutenants. So I was not surprised when he threw Tony under the bus in that testimony. But this is a group of people that have been competing with each other in this arena their whole lives, their whole professional lives, over three decades. And anything that Fauci says, in terms of absolving himself from guilt, he is not a person of integrity. He will say anything and do anything, and we've seen it again and again and again. I've really enjoyed in the past looking at old C-SPAN tape on Tony Fauci giving testimony before Congress, where he routinely goes and he basically has the same script, which is, this is a really scary virus. And if you only give me fill in the blank number, 500 million, 2 billion, it all depends on the outbreak, then I will get you a vaccine and I will take this pain away from you. And then the politicians give him the money and it all goes down little rabbit holes. And this is the first vaccine, if you want to call it that, that's ever come out of his shop, despite enormous amounts of money that they've spent.
Yeah,
it's a long sordid history, and we're only scratching the surface.
I'd love to. We've got a couple minutes here, and what I want you hit on something that I'd love to end on, which is we have gutted. Talk about gutting. We have gutted the confidence of the public in the healthcare system. and certainly in public health. And one of my gravest concerns, Dr. Malone, is what we are going to do when the next thing comes along and we need the public, not only in the United States, but globally, to pay heed and to follow our guidance as public health experts and as physicians. We don't have the luxury of putting the healthcare system in timeout while we, clear house and get ourselves sorted out and figure out who's culpable for what. Time goes on, and you'd never know when the next thing is going to hit the fan. What, in your mind, is it going to take to actually regain the confidence of the public? I have people say to me on a daily basis, the hell with it. I'm not going to the doctor anymore. I won't go to the hospital. I won't go, the heck with it.
So
I'm
Kelly,
on my own.
Kelly, I think, as you say, that this is going to take years and years and years to repair. And in the interim, the real question you're asking is, what happens the next time we have a truly bad event, if we do?
Exactly.
And looking back,
Exactly.
so a lot of this is predicated on the fear porn around 1918 and the Spanish flu, quote unquote.
Mm-hmm.
But there's a good case to be made that the excess mortality in that case in 1918 was due to overdosing of a new miracle drug that had just come onto the market that was used to treat fever. And it was not understood how to dose it. And so physicians would treat fever, and if the fever didn't resolve, they would treat with more drug. And then they would find that suddenly they had rapid mortality, which they attributed to the pathogen, but in fact, it was due to the drug. The drug was called aspirin. Okay.
Yeah.
I'm going to take
it's the fear around.
I'm not surprised by it.
That they exploit.
Right.
I'm going to offer a sort of marginal, maybe an outlying opinion, and say we deserve this. We did it to ourselves, and we fully deserve it. And the public is expressing good judgment in their relation to us. And in the future, we have to not be so certain and hubristic, and have a deep humility with how we approach these things, and understand people are going to not trust, and that's good judgment. And we have to rebuild some trust, but not overly medicalize things. Like Dr. Malone is just saying, the use of aspirin may have had as many issues as the pathogen itself. We have perhaps gone too far with the reliance on the medicalization.
I want to make a point here. I think that what is most likely to happen is the next time we have something that is identified by the World Health Organization as a major global public health threat, whether or not it actually is, what we will see instead, in lieu of a rebuilt medical system, what we're going to see is a further ratcheting of authoritarianism. They're going to use
We can't
this
let that happen.
As
We can't let that happen.
justification. I think
I agree that's there. That
likely
potential is there. I think that potential is there, but I believe that there is a certain amount of, the light bulb has gone off, and I'd never imagined that was a potential, but I'm sure I'm not the only one that sees that potential. And people are a hair trigger away from not allowing that to happen, somehow resisting.
So I have a colleague, Matt Schlapp, who happens to live 15 miles north of me. And some of you may recognize that Matt and Mercedes pretty much have salvaged CPAC, and they operate it. And I consider him a good friend, and I'm grateful for his friendship. He is of the opinion that we absolutely have to find some way to come together politically, that we've become far too divided. And by the way, he's very intrigued by Bobby Kennedy, but he does not foresee that we're going to be having major change here. And he emphasizes that, as I mentioned before, none of the politicians right now in D.C., not the Trump campaign, we could argue Mr. DeSantis would be glad to talk about COVID policy, but the Senate, absolutely not. The White House, absolutely not. The former Trump administration, absolutely not. They would like this all to go away. Right. And it's going to be a tough lift to really bring the public's attention to this. But Matt said that at CPAC Australia, the fury was palpable. And there was a subsequent vote which he asserts that the Australian government has essentially been overthrown. I'm going to be speaking in Brussels to the European Parliament together with a number of others next week, the 2nd, 3rd, and 4th. There's a subset of members of the EP that want us there and want to testify. They want to testify also. What we're seeing is in Europe, there is a growing anger. And there's some encouraging signs. For instance, the recent vote for the Farmers' Party in the Netherlands, in Holland, regarding the heavy-handed efforts to take their farms back by their government. I think that we're seeing some real efforts in Australia to get to the bottom of what happened and force the TGA, which is like their FDA, to come clean about the contracts with Pfizer and what was done. And I think we are likely to see momentum like that in Europe. For some reason, and it gets back to the propaganda and the Psyops, the American public have been lulled to sleep very effectively. And I don't know if we're going to be able to wake them up, more than about 20 or 30% of them.
Unfortunately, what
That's a
tends to happen in these things is when you have traumatized people, people are so happy when the pain stops. They're just so happy. They just say, oh my God, thank God it's over. Let's move on. And they forget to close the loop. Closing the circle so this doesn't happen again requires you to hold accountable those people who perpetrated this. It is not good enough just to say, thank God it's over. Let's all move forward. No, you've got to, at the same time, hold to account. Otherwise, it is doomed to happen again.
Oh, no, we just need a Truth and Reconciliation Commission and forgive everybody. Isn't that right? That's what the
There you go.
thinks.
No, exactly.
Kumbaya.
I'm
Irish. I'm Irish.
with you.
We never forgive.
As am I. So maybe that's why we get
There
along.
you go.
No,
Exactly.
I'm with you. I don't want to call for Nuremberg 2 and for public hangings. And there's a lot of strong words that have been tossed around that I think are a little irresponsible. But I had hoped and wondered whether we would see Tony thrown under the bus. And because he would be a logical sacrificial lamb to essentially absolve the rest of the bureaucracy. But it looks like there's a concerted effort to prevent that. You're hopefully aware that he's been hired back by the government and assigned 6 different agents from Health and Human Services to schlep him around and provide personal protection so that those that are calling for some action against him physically are not successful. So Kelly, all that I can say is from your lips to God's ears. But I've spent too much time in DC, and it's hardened me to the probability that there will be accountability.
Oh, well, Tony Fauci's like whack-a-mole. If you've ever played that whack-a-mole game,
we have to wrap things up. Caleb, you want to ask one last quick question? Go ahead.
Yes, I have a question, but I don't know if it's a quick question, so maybe we might have to wait for the next time.
Maybe we invite Dr. Malone back. This has been a really interesting romp through some interesting material.
I would love a chance to talk to you two again. I'm surprised, Dr. Drew, that you have you've come quite a ways since we last spoke. Yeah, that's a victory for victory. And maybe next time we can do it when I'm in my studio instead of in my car driving north.
Yeah, let's do that. Let's do that. And
when Rumble is up. I don't know why you're on the free speech channel is down today. All we have is YouTube, and so we're gonna have to upload you up on Rumble later. There's something going on. Right. We're not sure. But...
Well, in any event,
I hope
very generous. you've been very generous with your time. We will do it soon. I thank you so much. And I could. This stuff is fascinating to me. It's really why Kelly and I started this thing, is to figure out what the hell went on, and we pulled little pieces of all the puzzle together, and it's all starting to create a pretty cohesive story.
That
and you've
was
added
the
yet to it
purpose of the
again
book.
today.
Jill and I wrote the book as basically our journey down all those rabbit holes, trying to figure out what the heck went on. So thank you very much, and thanks for your leadership and efforts, both of you.
Thanks.
All right, Dr. Robert Malone, everybody. And Kelly, I'll see you. When am I going to see Kelly again? Is it next week, or are we seeing you tomorrow?
Yes, next week. We are on next Wednesday, I believe. Yeah. I think next Wednesday.
And I think we had to reschedule Malhotra. We have Shane Cashman, Kevin Bass going to talk to me, Petrovsky with Dr. Victor again, Bobby Schone, Nicole Sapphire is on May 8th. That's a new one.
Look at that.
So, and we're going to, as we said, we got a cancellation. Well, not cancellation. We had travel difficulty with Dr. Malhotra. So he will reschedule, and we'll bring
And Caleb was sick.
Well. And
And the router went down. We've had the weirdest things going on in this house. I had 2 cars break down today, too.
Yep.
It's the weirdest thing. And then the
and
Rumble
retrograde.
didn't upload. It's like
it's in the stars.
It must be a full moon or something. I don't know.
All right, everybody. Thank you all for being here. We will see you tomorrow at 3 o'clock Pacific time. Cheers. Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help. It's still going. Does it keep going? For how long?
He's just the most talented bull rider, and
he's caught on the bull. I think he can't get off. Right?
Yeah, he was also fine. He's good.
He's alive.
He was just staying on the whole time. Yeah.
He's totally fine. I think you're messing with me.
They are messing with you. This person is not fine. This person, these guys.
He's not okay.
He's not fine at all. There's nothing fine about this.
Do people do this for fun?